Welcome to NCSS Here for You. For over 50 years, Northwestern Counseling and Support Services has been providing access to quality psychosocial services to the residents of Franklin and Grand Isle counties. Over the years, as the needs of the community have changed, so too have the programs and services that we make available to assist children, adolescents, adults, families, and seniors. We take our role in the community seriously, and we strive to provide the highest quality services. According to Erik Erikson, a noted developmental psychologist, every person must pass through a series of 8 interrelated stages over the entire life cycle. NCSS provides a continuum of services to meet the needs of individuals who at any point seek assistance. NCSS's purpose is creating a stronger community, one person at a time. Now, let's get to today's show. I'm Joe Halco, Director of Community Relations for Northwestern Counseling and Support Services, and welcome to another episode of NCSS Here for You. Each month on this program, we discuss a topic of interest to local residents, and we do that with staff from one of our 3 direct services divisions. Our services divisions include Behavioral Health Services, Children, Youth, and Family Services, and Developmental Services. And on occasion, we have a member of our administrative staff discuss topics that affect all of our services. This month's episode is titled NCSS's School-Based Programs. NCSS offers extensive programming to schools throughout Franklin and Grand Isle counties. School-based clinicians provide assessment, counseling, testing, and home and school coordination for students and families. The Collaborative Achievement Team provides community support, case management, social and educational support services to identified students within their school setting. And the School-Based Autism Program assists students in providing effective, strengths-based interventions and programming for students with autism and developmental delays. To discuss NCSS's school-based programs in greater detail, I'm pleased to introduce this month's guests. They are Susan Trombley, NCSS School-Based Clinician Team Leader, and Dana Postemski, School-Based Autism Program Team Leader. Unfortunately, Amy Persons, NCSS's team leader of the Collaborative Achievement Team, also scheduled to be on the show today, had a last-minute conflict, so won't be with us. I'd like to welcome both of you to the program.
Thanks. Thank you.
Now, if we can begin, Susan, what does the school-based clinician program look like, and what services does it deliver?
Well, many schools throughout Franklin Grand Isle counties contract with NCSS to have a therapist within the school setting. We have a team of 9 people at present. Each school determines how best that therapist can serve that school community. We have a variety of services, including individual, group, and family therapy, consultation and support, as well as education with school staff, some crisis intervention services, homeschool coordination, therapeutic community integration, where sometimes we go outside of the school with children, and coordinating with other service providers. We also serve as a liaison to other NCSS programs.
And Dana, would you describe what the school-based autism program offers?
Sure. We offer a wide variety of services. At this point, they're really school-based services that kind of have a 2-tier model. Our first tier offers behavior interventionists or one-on-ones that work in the public schools, whether it be Franklin or Grand Isle County. We provide one-on-one supports to children with autism and some other diagnoses that fall within the developmental delay area. Our one-on-ones typically have bachelor's degrees, so they're somewhat well-versed in psychology, education, those kinds of fields, and basically provide behavioral supports to students that are in need of that. And then kind of our second tier is a consultation tier that if the teams feel like a child needs a little bit more support but doesn't need a one-on-one, we have consultants that can go out and support those teams, the classrooms, the teachers, the special educators, whoever feel like they need that support with that student.
And Susan, how are referrals generated to meet with clinicians?
Well, since the school contracts with NCSS, we have a referral team in each school, and the referral teams look different depending on the school, but generally it would be people like guidance counselors, special educators, perhaps the principal, school nurse, or any others that are deemed appropriate that would know the child. So anyone within the school, let's say a teacher has a concern about a child, they would go to the guidance counselor and discuss their concerns with that person, and then whoever is the point person would bring it to the counseling team, which in my school I'm a member, so that we would discuss the child's needs and decide whether or not NCSS services are appropriate for that child.
And Dana, how do people get access to your program for support?
Yep. Very similar process that we're a contracted service provider to schools. So typically the schools kind of support some of that contract as well as NCSS with Medicaid funding. So it is kind of a team approach that if somebody on the team feels the student needs more supports, whether it be through consultation or through the one-on-one model, teams have those discussions. They kind of figure out together, do we want to go this way? Do we not want to go this way? And then they kind of move through their channel of command, I guess, at school, that the principals kind of get that information and decide, do we want to bring in kind of this contracted service provider? And then if they make those decisions, they give us a call. Typically, they call me directly, and we kind of go through referrals in that way. So schools really, teams have to work together to make sure that people agree to kind of get our service in that particular school.
And Susan, tell us about consultation that's also available for educators.
Well, therapists can meet with any other of the team members. It doesn't necessarily even have to be around a child that we're seeing, but if a teacher or a behavior specialist or special educator has concerns, we'll sit down and discuss what those concerns are and try to problem solve either about behavior plans or developing some kind of a plan to help them out in the classroom, sharing pertinent information so that we all are on the same page with the children that we serve, but also to help them perhaps to decide whether or not they need more services for those individuals, so that we're able to offer that consultation and collaboration pretty much with any staff member in the school.
And Dana, if you could explain to people, what is the difference between the NCSS autism program and what school systems generally would offer?
Sure. School systems start with their supports with a paraeducator model. Some students don't even need a one-on-one, so it might be special education teachers that are providing the supports. And so they've gotten their education through, special ed programs, things like that might support people with autism. Our team, kind of what's different with that is that we've got a little bit added components to our training, and that people really are getting ABA, Applied Behavior Analysis training, and some of us are in programs. I am a board certified behavior analyst as well, and we have some staff that are in programs to move towards that. And really what it is board certification in behavior analyst, so we're really able to support students in the most effective way and kind of through the theory base, if you will, to be able to support our programming in a data empirical evidence way. So we really help offer schools a little bit higher level of the behavior support. Most schools don't really have a BCBA that's working in that system. Since sometimes kids with behaviors, they need a little bit extra support with somebody that's got a little more knowledge in that behavior ABA world. So that's kind of what we can really offer on top of what schools have.
And Susan, how important is family support in achieving a positive outcome for a student?
Well, parents and other family members know their children the best. They are with them many more hours than we are, and I think that family support in the therapeutic intervention is actually very critical in a positive outcome. The student is part of a family system, therefore that family system needs to be able to be involved in order to achieve the best outcome.
And Dana, with autism diagnosis rates on the rise, what is the diagnosis rate and how is it impacting schools in our area?
Sure. Yeah, the diagnosis rate really, in a sad way, it's been increasing quite a bit in the last few years. They've seen, I think it's been a 20% increase within the last even year with diagnosis rates. Right now, we're at a 1 out of 88 children diagnosed are born today have autism. In the past, we had 1 out of 110, so that's really increased within the last year, that diagnosis rate. Schools used to have maybe 1 or 2 children coming through on an IEP or with autism, and now, you know, one school said last year they had 24 children coming through in their kindergarten class, which that's a huge, dramatic increase. Sure. So schools really are trying to find a way to build their own internal capacities to support these kids, because the numbers are just getting outrageous at this point. And then they're also kind of dovetailing on the wraparound piece. How do you wrap around that for homes to get supports and all those things? So we're really looking at all those components. So schools at this point, they want to build their capacity. That's something else that we offer as well, is help building their capacity to have maybe more supports for kids with autism. Some schools are building rooms that are specific with sensory integration techniques built in, and so we're really helping build those capacities in those schools. So they really are working hard to figure out, you know, what are these needs coming in, the numbers are getting bigger, and how are we going to support that?
And Susan, what do schools say about the clinical programming that your team provides?
Well, recently one school, and this is kind of a quote, said that our therapists, that we happen to have 2 in this school, that they are an excellent resource for both the students and their families and the staff. And schools in general say that it's very helpful to have a mental health person there to address the emotional and behavioral needs, excuse me, and have a little extra expertise right there on the premises to be able to access easily, so that they can think about services in a much more timely fashion.
And Dana, are children with autism the only children that your program serves?
It's a great question, and actually, because the title is called School-Based Autism Program, it seems like that's all we serve. And then under that autism category, you of course have kids with Asperger's and pervasive developmental disorder. So all that falls within your autism spectrum. Mm-hmm. However, we do serve kids that have Down syndrome, other developmental delays, early childhood diagnoses, and things like that. So really, those kids typically with a cognition delay are the kids that really fall into our category. So no, it isn't just kids with autism that we serve on our team.
Mm-hmm. And I want to ask, both of you, for the programming that you each provide, a couple of things. Number one, I think it's important that everyone understand that each and every person that you deal with, each and every child, it's an individualized program. I think a lot of times, you hear a lot of terms thrown around, and you think it's kind of a cookie cutter, one size fits all sort of therapeutic approach. And I know at NCSS that couldn't be further from the truth. Right. But if you could just speak a little bit that, from your perspective, how important it is that each and every individual does have a plan that is specific unto themselves, and how you get there and collaborate with others to ensure that.
Well, when you're doing therapy with anyone, and we do therapy with children and families in my program, each and every child has an individualized treatment plan in which, based on the information and the meetings with the parents and the child, you develop in order to tailor that to the needs, because not all children have the same difficulties and concerns, so that the treatment plans are tailored to what the concerns are that are presented, and therefore the treatment plans are based on their individual needs rather than fitting everyone into the same category.
Mm-hmm. And Dana,
very similar, yeah, very similar. It's funny that you mentioned that. Actually, in the autism community, there's something that they say that if you meet one person with autism, you've met one person with autism. And that statement right there just shows the wide range of people that we serve. And, cookie cutter programs would not work with our students, because, gosh, you meet one and they're very different when you meet the next one. So it is very important to us to make sure that we look at the child as an individual, the family as an individual, and then really the school as an individual. What we see in this county, within Franklin or Grand Isle County, every school's different, their system differs, and so we want to make sure that we're adjusting to the needs of that specific community and that school and that team. So, it isn't just the student that also is getting individualized care, it also goes out to the schools, to each principal, to each teacher, you name it. So yeah, it's very important to make sure that each child we look at individually. And I'd say within our ABA model, that's really what drives us. Is in that model, we look at that one individual, we do our assessments and figure out what that kid needs, and then you move on to the next. So even our theory-based model really supports that, making sure that everyone's individual and they get individualized care.
And I think you make a good point when you talk about, the school is treated as an individual as well, because, again, I think many times what gets misunderstood is that an organization such as NCSS has a program, and that program everybody else has to fit into.
Right.
Where, again, I think it's critical to be able to express that at the end of the day, what's important is that each and every school get the services that they need for their particular situation, that they, as you say, may all be different. So whether it's Susan's programming or yours, Dana, that it is individualized service to that school. And I don't know if you have any examples that you can share, but I think that's extremely important because, again, I think too often you hear that an organization like ours has programming and people thinking, well, they have to fit within whatever the guidelines of that program are. It doesn't mean that they're going way outside the guidelines. All it means is, what does a particular school need because of their circumstances? And NCSS will deliver that service to assist them.
Yeah, and I think you have a good point to kind of dovetail on that I think when we even first started this program in 2007, you have this model, you want to fit into that model, but that doesn't always work, and you do have to look at those individual needs. And we have some schools that don't necessarily want full ABA services. They may just want somebody to be there to help support the team and the family with autism specialty. It may not even be a behavior approach, and so we will make sure that we look at that and support those schools with what those needs are. So yeah, I mean, that's just a small example of what we've done to kind of get outside that little box that people think you live in, but it's so important to do that, definitely. And I think our schools appreciate that as well.
Well, and it's important to remember that the school, it's kind of like a two-layer. The school is a consumer, and then the students that we see are the consumers. So there are two consumers, and in our program, the school is basically determines whether they want more of a traditional therapy approach, whether they want a combination of therapy and homeschool, that schools, since they are contracting with us, are also talking to us about what they feel their particular school would like that fits into their community, because every community is different.
There's one other area that I think is really important that people understand, and that is that probably of any type of an organization that anybody is affiliated with, there's no one who treats confidentiality more importantly than an organization like NCSS. And I think if you could just express from your programs, so people understand that, it's paramount in everything that you do in your programs, the confidentiality of those that you serve and the importance of that. Because I think, again, so often people think that if there's a particular service that's going to be provided by NCSS, they happen to know someone who works at the organization or what have you, and they're fearful that the information's going to get spread. That couldn't be further from the truth. If you could just speak a little bit about how we guard, or you guard, confidentiality with your teams, first and foremost.
Well, we have many safeguards in place. We have very careful paperwork and documentation to help explain to the families that their information is very private and that we make every effort to maintain that. And we talk with them about what types of things that we share and what they're comfortable with sharing, so that they are very, very clear at the outset what kind of information is going out, and that confidentiality is and always will be the cornerstone of any kind of mental health treatment, whether it happens at the agency, whether it happens in the schools, anywhere. That is still the cornerstone of mental health services.
And to dovetail a little, I mean, yes, there's the paperwork, those pieces that we go through and review with families, but, we know it's a small community here, too. And, I go to the grocery store and I see many clients that we serve, and, I think sometimes it's that discussion with people of, if we see each other in the community, do you want to share that we know each other or not? Those kinds of things. And so it even gets down to the ground level of the person and talking with them about what's your comfort level, that if I'm a Hannaford's, how's that feel feel when we see each other. And, you know, I work with kids and families, and most of my kids want to come over and say hello, you know. So I will say most of them want to, but really that's up to them. That's their decision to make. That's not for us to make. And, you know, knowing it's a small county, we want to value and cherish that, you know, those confidentiality pieces, because, you know, people are afraid people are going to know. And so really being out front on the table is just so important about that. And then again, sharing, you know, what that policy is, that, you know, we're not going to go above and beyond in the community. If we see you, it's, you know, it's really up to you, and you drive that piece. So that's just another little thing. But the little kids I work with usually want to say hello.
And, you know, speaking, one last thing on the confidentiality is the fact that I think relieving people's minds that really the only people who ever see information about a particular individual are those that are on the treatment team, and no one else. I don't care who you are in the organization.
Sure. Yeah, we have safeguards. I mean, you even type in a name and it's, you know, you can't get in, you're blocked, you know, so even within the agency there are those safeguards, definitely. Oh, yeah.
Now, are there any, and I know that Susan had shared what one of the schools had to say about her program, but are there any sort of success stories that you would like to share about how these services are so impactful for the individual and in many cases our families as well?
Yeah, I mean, many stories, but I guess, you know, you always think of the most recent thing going on. And I have been working with a student since he's 5 years old, and he's in middle school now. And so I've watched the student grow for many years. And, you know, when he was younger, he was this aggressive kid. And now, I mean, he is just, you couldn't pick him out of the classroom. He's doing so well. He's accessing his own needs. He's advocating for himself. He isn't that little aggressive kid that's going to trash the classroom anymore. He's actually part of that classroom and really giving a lot of input into like science, where he's doing really well. And so it's actually nice to say in 2 weeks we're not going to have a one-on-one with him anymore, and he's going to be going to school all by himself. And I think for him it feels so good. He's been working so long to really get rid of his BI, you know. His whole day has been, I'm going to be getting rid of you because I can do this myself. And that's really what we want to see, and that's really the goal of our program, is for these kids to have empowerment, to feel like I can go to school and not have you there, and it's a great thing. So it feels really good for everybody on the team, not just the student, you know. But I've been watching this kid since he's 5, and I almost teared up at our last meeting, like, wow, he's growing up. This is so great, you know. So there are lots of good stories like that.
Well, and I would make a more general statement that I think that the success of my program speaks for the longevity of both the staff in my program and also the length of the contracts. And we've had most of the contracts for at least a decade, and the schools must find it quite valuable because they do renew their contracts each year, and all of the therapists that I have in the program, the majority of them have been there a very long time as well. So I would say that in a general way, that speaks to the success of the entire program.
Well, that, and Susan, also, I think people might be surprised at the size of your team. How many team members you actually have?
At present, I have, including me, I have 9 therapists, and we're working on another contract, so perhaps 10.
And Dana, from your perspective, as far as your team?
Yeah, we started with just Dana in 2007, and we built the program, and now we're about up to 24 staff under me. I think within the next couple months we'll be at about 26. So we've definitely grown, and community's been really responsive to our programming, and we've been happy to be here to offer that as well.
Well, the one thing that's certain is the fact that in many young people's lives, I mean, they struggle, and certainly without the terrific work that your teams do, they wouldn't be able to come out on the other end being better for it. Because I think a lot of times, certainly, as great as a home environment can be, you know, for that particular individual, it just may not seem right. And it's really with the help that you provide them in the schools that really helps them to take that next step.
Yeah. And what's nice about that, really, to be honest, is the schools really want to see these kids do well too, and they put a lot of value in that piece. And I think without that piece, you know, we wouldn't exist. That collaboration that we have is just so important with those schools, and having that open, honest way of, boy, we really need this. Can your program do that? And those are just the conversations that we need to have to be able to really meet those needs for those schools too.
And speaking of collaboration, I mean, it's obvious that the schools are a collaborator, but if you could speak to, are there particular situations where maybe there's even other organizations in the community who are at the table to try to ensure someone's success?
Yeah, I'll take that first if you're okay with that.
Sure.
We have lots of community partners. I mean, you know, from home health to medical center, things like that. We also are really good partners with a child development clinic where the CDC comes to NCSS to do diagnosis for autistic individuals. So we have a really close medical relationship with them about if we have families thinking there's something going on with their child, they don't know exactly what's going on, we can kind of refer them to that medical staff to help give that support with diagnostics and things like that. And then, you know, of course, we've got speech and OTs and PTs out there that are good collaboratives with us. And then on top of that, the other mental health agencies in the state that run autism programs, so, you know, Howard Center, Chittenden County, Addison County, and one other, Washington County also have programs similar. And so we do try to get together to meet, to talk about, you know, where are these programs going, what are the needs in the future, you know, where do we see ourselves in 5 years, what is that need for our community or really in Vermont. So it's really nice to have that other collaboration for other programs to sit down and meet and talk about kind of what our journey's been and where we're going. It's really helpful.
Susan, anything to add?
Well, I think that in general, we have a lot of community agencies just within our 2 counties that dovetail with that in terms of, you know, primary care physicians, home health, DCF, and other Voices Against Violence. We just have a lot of other agencies that, in trying to help the entire family system, we don't want to just look at one member, but just to try and increase the health and mental health of everyone.
And I think that's important. You know, it's sort of like now with what's transpiring with healthcare and how people are starting to recognize the fact that, you know, someone goes in for, say, an operation, and it's a very trying time. They come out on the other end, and maybe because of that operation, they start to become depressed because they realize the fact that maybe they're not going to be able to do certain things that they were able to pre-operation in dealing with that. So as part of that whole recovery, it's not just the physical elements, but it's the mental elements as well. And as we get closer and closer to have mental health embedded into primary care practices and that sort of thing, I think people are beginning to understand, you know, a lot of times you say the words mental health and it's very stigmatizing to people versus physical health.
Right.
But the work that you do, and in collaboration with whether it's pediatricians or others, I think really shows how it dovetails together, and you're really looking at the holistic approach of the individual and their families and trying to get at what's the best way to make their life better than it is today.
Yeah, and that really is, you hit it on the nose. A lot of my families, it's about quality of life, you know? Yep.
Okay, well, it's hard to believe, but our time is up this month, and this has been a terrific discussion about the NCSS school-based programming. And as I said earlier, we really had intended to have another portion of our school-based programming also represented with Amy Persons and the Collaborative Achievement Team, but unfortunately, she had another more pending situation to deal with. So hopefully we'll be able to catch up with Amy another time. So I want to again thank my special guests Susan Trombley and Dana Postemski for being on the show today and sharing their insights on the NCSS school-based programs offered throughout Franklin and Grand Isle counties. And I also want to thank you, the viewer, for spending time with us again this month. I'm Joe Halco, and I'll be back next month with another episode of NCSS Here for You. This has been another episode of NCSS Here for You. We hope that you found today's discussion informative and educational. For over 50 years, Northwestern Counseling and Support Services has been providing access to quality psychosocial services to the residents of Franklin and Grand Isle counties. Over the years, as the needs of the community have changed, so too have the programs and services that we make available to assist children, adolescents, adults, families, and seniors. Thanks once again for tuning in this month. NCSS's purpose remains creating a stronger community, one person at a time.